Then there's just one or two things I noticed.
Any other contribution? Okay. So let me make my contribution, then I will give you. Thank you very much, Chief. Just to add to what Chief already mentioned, in the biodata, occupation is important because the occupation could actually give a pointer. Because even as a 15-year-old, they might, even their family occupation is fishing, and that's a very important risk factor. So occupation is there, and I feel during the role play, the patient too can even tell you that he's a fisherman. If you get to ask him his occupation, that will add up to easy flow of the history. And then okay, history of medication has been talked about. Then other history concerning the complications and other risk factors, such as other urinary symptoms, dysuria, frequency, fever, difficulty in passing urine, easy fatigability, probably from anemia, since we are talking history wise. Yeah, so all those ones. And okay, the last one have already been mentioned, like you should as much speak in layman's terms as possible. Thank you very much. By and large, it was a wonderful discussion. Thank you.
Thank you. Okay. Please,
it's for the record.
Okay.
It's not for amplification. It's for video.
I just want to say, in terms of the investigations, you know, as a clinician, as a health worker, based on what resources are available, I was thinking it would be specific. We'll do this. They were saying we might do this, we may do this, we may do this, and I don't know. Like if you go to some of those PSCs or general hospital, if you are telling them we may do X-ray.
Where we have that.
What I was. Okay. But what I'm saying is, in the context of this program, I was thinking they have. This is what they want. At least to start with, let's do urinalysis first. If it comes out negative, no over of schistosoma seen, and we still have high index of suspicion, we can now say, okay, let's have a scan, let's do this. But I don't know whether in the context of this program, whether we are allowed to do a barrage of investigations or to just, for the program, use urine microscopy as a diagnostic tool. I don't know whether you need to.
Yes, I understand.
Okay.
I think for the purpose of this, at least let them hear that urinalysis first, because it's readily available. So others you can still mention.
Even in our tertiary institutions, like, I don't know where it works. And now, if somebody comes and you are suspecting this, you know, within the context of this program, are you allowed to go for investigations? I think if you do urine MCS and there is over, you know, unless maybe you are suspecting complications.
Other complications.
If there are no complications, like he said, he doesn't look like somebody who has complications.
Yeah, you can just go ahead to treat him.
No, you said it and
He said it's passing bloody urine.
yeah, you said he doesn't look like somebody who has complications. He mentioned, I don't know whether
Oh, I said so.
Yes.
So I was wondering how you would know.
I don't like to say blood. Most of our patients will not come and tell blood.
Yes.
Will tell you
But he was able to know you don't have complications.
Yes. So I think that is where even the other investigation that you might do other things, at least for the purpose of the discussion. But I think for the urinalysis.
Sorry, please, I want to get some. For the purpose of this thing, let them finish. For the purpose of this thing, I think since this training is mainly for us and the PHCs, we can stick with the simple investigation, that is microscopy, if we are really suspecting only schistosomia hematobium infection. Because looking at the situation we all are in now, honestly subjecting this patient to MCS and other investigations. In fact, MCS will take at least 1 week for it to come back for you to treat. And looking at the people who are supposed to be having this disease, again, their socio-economic background need to be considered. So a lot of factors are here, has to be there. Let him.
Almost like a routine now for you.
Yes.
No, yes or no? You do scan, isn't it?
Yes.
Because it's difficult for me to see a hematuria patient and I won't scan that patient. That's why you can pick a lot of these bladder cancers.
And I think the urinalysis and ultrasound scan, they are readily available.
They are readily available.
In all general hospitals at most.
Because a lot of the bladder cancers I've seen were just on first presentation or ultrasound.
Sorry, I want to let him finish so that if.
Okay, I think it's the overall.
No, I'm not. I'm just going to suggest.
Okay,
let me get this stuff clear, because I'm acting like the doctor. You understand? And then I want to know what we are trying to achieve. I'm placing myself in an exam situation, for instance. You understand? If I am going for an exam, what's expected of me concerning the case is different. Now, the role play we are doing, which is something I've done before severally, is the role play streamlined to schistosomiasis, or it's me as a doctor sitting in my office, a patient walked in, and I have to dig through a gamut of questioning and then investigating and evaluating. Because the feedback I was getting, it's like I have to go beyond the scope of schistosomiasis. You understand? I have to go via gamut of differentials, which if I found myself in Lagos, my part 1 exam or part 2 exam, as the case may be, I won't think that this patient has schistosomiasis first. You understand? But with the context of a role play, we are trying to stage that a patient who has schistosomiasis has walked into your office, both in a resource poor setting and a rich setting, probably. You understand? So I was of stepping down the notion that, oh, okay, this patient just coming. One, I might not have that much time to take a gamut detailed history following the various aspects. Of course, I work with children, so it's going to be easy to walk in the park for me to ask the various aspects, which can take like immunization history, birth history. You understand? So I felt going through those steps and the rest will be time wasting, since it's a role play. So I just brought myself down to seeing this patient and, okay, this is schistosomiasis, 15 years, neglect this, and then focus. But if it's you telling me, oh yeah, this patient is here, evaluate generally, is that how we are going, or we are going with a patient who you have high index? Because most of us in general hospital, we don't even have that much time to interact because of the number of patients we have waiting for us. So am I streamlining myself to just very few, or you want me to go through the barrage, the various steps of, history taking that will arrive at various differentials, and then I streamline to this particular one? He said, yeah.
That's an idea. When a patient comes to see you in the clinic, we're not talking about when there are too many patients or not. We know the right things to do, but because I'm coming, sir. I'm coming. We know the right things to do, but because of time constraints on many patients, we cut short, at times. At times you see people not wearing gloves, but we know we're doing the wrong thing. So I think a role play should be an ideal for you to go through a barrage of questions and assess the patient that came with red urine. But you'll be summary, you understand what I mean? So that every other person will know this is the right thing to do.
Thank you very much, sir, for your contribution. I think, sir, like you are actually right. I understand your question. But what I want to say at this point here is what the chief said was right. But I think if we may put it in a context, just like we said in an exam, it should be a focused history taking. And focused history, like from the response of the patient, at least giving you bloody urine and not giving you any other symptoms too. That means the history should be streamlined towards that, but at least those few differentials from, because I think the role play for them is mainly for them to actually know that we actually have good information on all those signs and symptoms they gave us, the complications, we are able to rule them out and all. So if we can be able to use our line of questioning to rule out those other symptoms and all other complications, and then some few questions to rule out other things, that's okay. Yes, thank you very much, sir.
Thank you. All have been said. What I wanted to point out is that for the benefit of this group presentation, we should is to take history and make diagnosis of schistosomiasis or schistoma hematuria, because the other goal is for them to treat the condition. So we should supposed to have at least select somebody to serve as lab scientist, so that as you took your history, send to the lab, immediately make the diagnosis of schistoma hematuria. Then the other group will now treat schistoma hematuria. That's what I wanted to add.
The presentation will be presentation. What I'm saying is, someone was jotting down the history that was taken. I think I saw somebody jotting down history. So maybe the person jotting down will make the presentation. You know, then in terms of lab investigation, we've agreed that there was hematobium over in the urine. So because we can assume that if you because I think within this context, it doesn't mean that person has hematobium cannot have any other pyelonephritis, may not have even some of the bladder stones you see, they come with hematuria. Issues. Yes, but this one we are just looking at, we are assuming, I don't know, that's my thinking, we just assume that hematuria is overexposed there, but we didn't investigate for complications. But if you say, okay, we did other investigations for complications.
At least, I think we should also tell the patient that we are actually, at least within our own capacity, that we are assuming in a general hospital per se, we can still do other investigations. You can do PCV, we can do electrolytes, urea and creatinine, I think, in some of the centers. In some, sir, I think.
No, it's done.
Okay, in some, not all. So, thank you. Is there any other thing? So I think by and large we are good. Yes, I think we are okay.
What kind of water? Stream or just stagnant? Stagnant water. Oh, okay. Is okay. Now, do you notice any other person having this thing within your family? Just you alone. What about your friends that you play together with that you? Okay, none of them are speaking to you about this stuff. Okay, and then. No, but it's always good you talk to your your parents, and then your friends. You don't know what they are going through as well. It might be something related to your environment. You understand? So it's always good you talk to them so they can give you feedback, and then so that if we find out this thing is from your community, it should be good for us to investigate and also know where the root cause of this is coming from. You understand? Now, since this thing started, what have you done? What medications have you taken?
I've not done anything, sir. I told my mom, that's why she asked me to go to hospital.
Today, okay, but you said it's been a few weeks. So why particular now? Is it that it's worsening?
It's not paining me, it's just after finishing my urine.
Okay. Now that change.
I wasn't thinking it was something really.
That ending part that usually come out, did you notice any clots, any particles, anything?
Sometimes there is small blood, but it's not always.
It's not always. Okay. Are you taking any medication currently? Do you take this, there's this something they call roots, that if you take, sometimes it can change the color of it's not cassava. I don't know the name in Hausa, but it's beetroot. We call it beetroot. It can change the color of body fluid. Okay, I'm not taking any. Okay. Okay, that you take. Oh, okay, all right. So maybe it's not what I'm talking about. It's all right. So you said since this started, you've not had any medications because it's not paining you. Okay, but you've also informed your mom, and then she asked you to come to the hospital. Have they admitted you before? Have you been admitted before? Have you been transfused before? Do you know your genotype? You don't know, you've not checked. But is there any, when you were growing up, anytime you had your legs, your hands, your body paining you? No.
I've never been hospitalized.
Since you were born. Wow, that's good. And you're 15 years. And then your siblings too. None of these hand, leg, foot pain in none of your siblings. There's none. Oh, okay. All right. So you are in JSS 3. How's your performance like in school?
Performance is average.
You are average. Okay, you are doing very well. What's your last position? Last time? Out of 30. That's a very good one. Okay, 2 minutes more. Okay. So, all right. How many are you in your family? You are 6. You are what number? Number 3. Oh, okay. All right. So I'm going to check, examine you, and then check your weight as well. Let me see, because that urine you are passing could make you to lose blood. Okay, you are not appearing pale. And then let me see an abdominal examination quickly. All right. So come on. Yeah, let me wait. Okay.
Am I in big trouble?
No, you are not in any trouble. You don't need to worry yourself. You move your shoes. Yeah, just check your weight. Your weight is 26 kg. So you can sit down. I'm going to carry out some tests on you to help us ascertain what we are suspecting. From all you've said, it's looking like schistosomiasis. We are not 100% sure yet. It's called, it's an organism, it's a parasite. No, you don't need to. Yeah, that's why I said you don't need to be afraid. You understand? We are going to investigate. It might be it might not be it. Most times it's gotten around the stagnant water, and then it's something that is treatable. You understand? So you don't need to worry yourself too much. We are going to investigate. We'll check your urine. We'll also check your blood level, check your PCV. We would have loved to do a full blood count for you to also see other aspects of the white blood cell count. So you urinate here, we'll take to the lab, and then the lab man will run it for us. You understand? So you give to the lab.
And This is the sample.
Okay, this is the sample. Okay, Sanu. Okay, so please you can wait like 10 minutes. After I finish the examination, I'll give you the result. So you can take it back to the result to the doctor so that he will prescribe those for you. Thank you.
Gama fitsarin shine sai ka ga jini ya biyo, shine abun da ake ce ma bilazi, amma ba wani damuwa bane. Magani ne wanda yake yana da magani insha Allah sosai ma malam. Ai akwai mutane da yawa da suka zo nan kuma mun ba su magani kuma alhamdulillah sun warke. So ba wani damuwa bane, ba abu da zaka dai da hankalin ka bane. In haka dai kuma amma wanga ba damuwa bane malam. Lafiya kalau malam. In haka ba shi magani insha Allah zai warke. Ba wani damuwa bane. Ai kaga shi yana da magani ko ba haka nan ba. Kuma maganin da muke bayarwa maganin ne ana ce mai praziquant. Duk da yake kai ba za ka gane ba. Muna da iyawa da saboda kai ba ka fahimce ka gane me ake bayarwa ko ba ka ba. Praziquant ake ce maganin. Shi kuma kaga inda abun ke da sauki. Magani ne wanda ake sha rana guda. Za ma bayani yadda za ka sha shi, amma rana guda shine za a sha. Kaga akwai matsaloli wanda za ka iya ci gaba da shan magani ko haka nan ba, amma wanga rana guda ake sha wannan maganin da nake ma bayani. Ka gane ko? Kuma maganin abai 1 plastic bottle, sorry. So maganin akwai yadda ake shan shi ne, kuma ana so ya zama cewa a bi ka'ida akan yadda za a sha magani. Kagan komin ba bi ka'ida ba akwai damu. Bi ka'idan shan maganin. Me kuma ka'ida dan magani ne wanda yake kasa na gya maso guda, so rana guda kawai za a sha, amma rana gudan so uku. Kamar yadda kake ci abinci sau uku a rana, ka ci da safe, ka ci da rana, ka ci da dare. Amma wanga kuma yana da lokuta wanda ake so mutum ya sha shi maganin. Ka gane? Ka ganga maganin nan an riga an kai an sa shi ya zama kamar alaman ruwa, yana zuwa kamar tablet ne, amma tun da ka gan shi nauyin shi ba zai iya shan guda ba, mun tura an narke shi ya zama ruwa. So shi zai sha ne da safe bayan awa 6. Na farko zai sha mafi biyu zai sha bayan kowane lokaci, amma ya fara da safe din. Sai bayan awa 6 kuma sai kawo shan wani mafi, sai bayan wani awa 6 kuma ya kawo shan wani mafi biyu. Ka gane yadda muna ma bayanin shi ko? A'a, ai na ce ma rana guda. In bai kare ba sai a ajiye shi kawai. Ai rana guda kawai za a sha, yan sha rana guda shi kenan. Amma abin da ake so a sha shi bayan awa 6 mai biyu so 3 a rana. In ka sha na farko sai ka sha kuma bayan awa 6, sai ka sha kuma bayan awa 6. Kuma ba a so a sha fiye da mai biyu, saboda sha fiye da mai biyu yana da illa. Ko ba ka nan ba, kuma ba a sha kuma kasa da mai biyu, tunda ya ka sha kasa da mai biyu ba zai aiki yanda ake so ba. So a ka'ida mai biyu ake so a sha. In ya ka sha na farko bayan awa 6 a sha na biyu, bayan awa 6 kuma a sha na uku. Bayan awa 6. Kaga abinci daban kuma shi magani yadda za a sha shi daban. In dai sha yanzu sai ka duba awa 6 sai ka sha, bayan wani awa 6 sai kuma sha. Ka gane bayanin ko? Kuma maganin in yana sha, in an ganka ma ba so mantuwa, saboda ya ka manta maganin ba zai aiki yadda ake so ba. Amma kuma dukanmu dan adam ne ko? In ya ka manta sai zama na biyu ya fi kaiwa lokacin da ya kamata ba na uku, kan hada duka biyun tare lokaci guda. Ka gane? Sai a bari lokaci na uku ya yi sai ya sha, sai bayan awa 6 sai ya sha na uku. Amma ba a so a yi mantuwa. Ka gane bayani na ko? Ana so a bi ka'ida din, yana da muhimmanci. Abu ne wanda aka bi ka'ida za a samu nasara insha Allah. Haka ne. maganin kyauta ke bayarwa, kyauta ke bayarwa. Gwamnati ta ba da shi ne saboda mutane da yawa suna da wanga matsaloli, shi yasa gwamnati take ba da shi kyauta. Kagan ko abin da ake ba da kyauta ana so kuma amfani da shi yadda ya kamata, ko ba haka nan ba. Ka ji ko ga Muhammadu, ka yi kokari ka sha. Ka gane bayanin ko? Amma kuma akwai wani bayani, in aka fara shan magani aka gan wani damuwa, kamar a ji kamar ya yi gajiya da yawa, ko kuma ana ne kamar kubaje ko mai wani abu a jikin shi. Amma in bai yi tsanani ba dole sai dawo ba, amma in ya yi tsanani a yi kokari a dawo da shi asibiti. Amma in bai yi tsanani ba shi zai ana akida a kishin maganin ba. Inda an ga wani a ci gaba da bashi yanda ka'ida ya ce, inda abun bai yi tsanani bai yi wani damuwa ba wani damuwa, wasu sukan samu haka in suka fara shan magani. Ka gane bayani na ko? A yi kokari a bi wannan ka'ida. Kuma ka ga wangan matsala ana samun shi ne mutum ya je rafi wanka. So ka san wajen ruwa wajen wanka. Ka gane ko? Ai wajen rafi ko ka zuwa rafi. To akwai daga ruwan akwai abun da ya cije shi yake samun wannan matsala a jikin shi. To ka gani kenan in mutum bai je wajen ruwa ba zai wuya mutum ya kwashe shi ko? In kuma ka bada magani ba su kuma ya kara dawowa da wannan matsala din. So in ya sha maganin a yi kokari a kiyaye shi da zuwa wajen ruwa. So kuma a gida a yi kokari ana zuwa bayi ana bayan gari ko kuma wajen fitari. Ka gane bayani na ku? Wannan kaida yana da kyau saboda ka dinga ba wasu ma wannan cuta din. Ka gane? So yadda za a yi nan ka gane. Kuma in kuka kai gida in kuka ga wanda ke da ibon ga matsalolin a tuwa su asibiti. Ka ga maganin kyauta ne ba san biya ko naira ba, gwamnati ta riga ta ba da maganin ga irin wanda suke da wanga matsala, sai a yi kokari a dinga tuwa su asibiti ana duba su, in ya ka gano shine sai a ba su magani. Ka ga ba da wani kuɗi ba. Ka gane a yi kokari a bi ka'ida. Inda suna wannan fisarin jini in ba gane fisarin jini nan ba, amma kuma a kiyaye su ma su daina zuwa rafi. Ka gane shi kuma zai taimaka sosai. Ka gane yauwa ga maganin yanzu a tashi yadda na ce. Ka gane bayani na sai an girgiza shi sai a bashi mai biyu, bayan awa shida a bashi wani, bayan awa shida kuma a kara bashi wani. To ku dawo ne bayan wata guda muke so mu dawo. In ya dawo sai a ɗiban jinin shi a sake mai awo mu tabbatar cewa abun ya warke. Ko aji tsohon maganin ba sai ya tashi bayan bai kare ba damuwa ba ne, sai ya aji tsohon. Ka gane bayani na ku? Akwai wani tambaya da kake so ka yi akan wannan maganin ko kuma akwai matsalar shi? ake so kaga ko an samu ruwan ko dana ya tafasa ruwan ka gane a kawo gida a dafa abinda ba so ne mutum ya je shiga ruwan ya ce yana wanka ruwan ana iya dawo a kawo su da inda su kada kuke da shi kaga ba da ce ba za da ce ka ku amfani da ruwa ba ko inda su kadai ne ya ka debo daga rafi a tafasa su a sha ba damuwa bane a yi wanka wayan ba duk wannan ba damuwa ba da ma bane Allah ya taimake ku wayan wata ya ka samu wanda ke da matsala ko muna su duba su ma ba su magani su warke insha Allah Allah ya taimake mu a ko ne ba ka bayawa gwamnati ta biya ma ta biya ma insha Allah Allah ya taimaka yau
interaction, especially the patient too is very the patient actually feeling like like a 5-year-old girl. You know, girls, they are too shy. They don't even communicate in the midst of the mess. So he was just doing like this. He never say anything. And the father actually also behaved like a typical village man. You know. There is one thing with the village people. The little you do, they appreciate. If government can do something very little to them, they are just, even you as a person, if you have a relation who is in the city and one in the village, you give him 5,000, the way he will appreciate you. While the one in the city, you give him 50,000, he will say after all, he is a doctor, he will be calculating how much salary you collect.
Mai Biredi TV, Mai Biredi TV, ga Mai Biredi TV, faɗakarwa nishaɗi, sai Mai Biredi TV. Gagara gasa online TV, Mai Biredi TV, gidan TV mai faɗakarwa, tare da nishaɗantarwa.